Hello and welcome to this webinar, the United States Public Health Service, an overview. My name is Lieutenant Brian Wilson, and I am a pharmacist with the United States Public Health Service. I am an alumni graduating from the West Palm Beach campus pharmacy school in 2012.
Brian, can we give a couple of minutes for everybody to join in just in case, because I can see attendees still entering in.
Oh, okay.
Thank you.
Yeah, that sounds good. Oh, it looks like it's not going up anymore. So I'm just going to go ahead and continue now. So again, this is Lieutenant Brian Wilson. Currently, I'm working in the Office of the Secretary as a United States Public Health Service Commission Corps officer in the Recruitment and Assignments branch as a recruitment specialist in the Washington, D.C. area. Prior to working at Commission Corps headquarters, I worked at the Indian Health Service in Northeast Arizona, and I got experience in a lot of different areas of pharmacy there as an inpatient pharmacist, emergency department pharmacist. I got a little opportunity to work in pharmacist-ran clinics with anticoagulation and diabetes, and I also had an opportunity to work with pharmacy informatics and also in the quality management team. So this is a webinar that's offered by NSU University Advancement as a resource to alumni, supporters, and community members. This video will be available later on YouTube as a resource through the NSU Alumni Association. And we'll start with the presentation and we'll have a Q&A session towards the end. So please feel free to type your questions in to the chat or to the Q&A box, and we'll answer those questions at the end. So now I am going to hand it over to Lieutenant Kazarian so she could give a quick introduction, and then we'll get started with the slides. Thank you.
Hello, everyone. Thank you for being here. And my name is Lieutenant Nellie Gazarian, currently similar to Lieutenant Wilson. I'm stationed at the Office of the Assistant Secretary for Health, where primarily my work involves public health programs within the HIV realm. And previously, similar to Lieutenant Wilson, I was also a clinical pharmacist within the Indian Health Service, where I practiced in various different clinics like hepatitis C, HIV, anticoagulation, tobacco, diabetes management, asthma, and COPD management, pretty much covering chronic disease states. But without further ado, we'll continue on with our presentation. Next slide. So just a brief overview of USPHS. Our official motto is In Officio Salutis. It means in the service of health. It was established in 1889. The USPHS, or the Commission Corps, is solely committed to protecting the public's health. The Commission Corps is part of the U.S. Department of Health and Human Services and is overseen by the Assistant Secretary for Health, or we fondly call him the ASH. The U.S. Surgeon General and the Deputy Surgeon General also provide operational command for the Commission Corps. Next slide. Just to go over a little bit of the history, in 1798, it was established the Act for the Relief of Sick and Disabled Seamen. And as you can see and go through this, you will see eventually the U.S. Public Health Service was created. Next slide. So who are we? The PHS, or the Uniformed we're part of the 8 uniformed services, and we are the only ones that are dedicated solely to protecting America's public health. We're made out of 6,000 public health professionals that are dedicated to addressing public health and providing clinical care. Just know that we'll be at the forefronts of a lot of our deployments, especially during this COVID time, and Lieutenant Wilson will go over some of those later on. Next slide. Our mission and values. If you ask any public health officer what is our mission or value, I bet you we could recite it in our sleeve: to protect, promote, and advance the health and safety of our nation. We do have some core values that we look for applicants that apply to the USPHS, including leadership, service, excellence, and integrity. Just know that as we are both Nova graduates, you heard earlier, we have been instilled some qualities of leadership, and now when you come on, if you do decide to join the USPHS, the Public Health Service, you will be given a bigger platform to not only continue ongoing training towards your leadership, but also enhance your clinical skills. Next slide. Next slide. Here are some of our professional categories that we are currently recruiting for. Just know that this is very broad, and I would encourage you to visit the USPHS.gov website later, whenever you get a chance, to see who all may qualify. We are both pharmacists. We do have a team of medical professionals, dentists, veterinarians, nurse, EHOs are environmental health officers. So there's a big category of professional officers that we recruit, and when we often deploy together, you can see how we all marry together to really protect and promote the health and safety of our nation. Next slide. Here are some of the locations or agencies that you may be able to work at. Currently, we are both at the Department of Health and Human Services under the OASH, or the Office of Assistant Secretary. There are other opportunities with CDC, CMS, HRSA. They all have different roles to play. Department of Defense is another one. DHS, a Federal Bureau of Prisons is another one where a lot of pharmacists do work. So just know that there's a lot of opportunities, a lot of different programs that you could be part of, depending on any category that we reviewed earlier. Next slide. What do we do as Commission Corps officers? We provide essential health services. We go where we say to serve the underserved. We serve on the front line of public health emergencies like the hurricane response or the COVID-19 response. Our biggest one was overseas was Ebola outbreak. We do lead public health programs and policy developments from the HHS side of things and throughout the federal government. We are at the front line of advancing innovation and science in different areas related to COVID crisis, cancer, and opioid crisis. And a lot of our officers are also stationed at the NIH, which is at the forefront of any advances in science. Next slide. Here we have listed some of the benefits of joining the service. Career diversity, I spoke about earlier. Professional development, where you have training and educational opportunities in different programs. Work-life balance is great. I myself have 3 kids, and I'm really, really thankful that I'm an active duty officer that does, although we're on duty 24/7, we do have a great work-life balance. When I went on maternity leave, I did have 84 days of paid maternity leave. So that was very appreciated. Some financial advantages are also listed here. We are considered the uniform services, that would be our benefits are similar to our sister services, sister armed services, which would include benefits like health insurance, like TRICARE. We also have the GI Bill, and it's more of a 401 style retirement plan these days as well. We do have specialty pays for some categories that are hard to recruit as well. Next slide. We do offer these benefits that I went over earlier, different career opportunities and professional growth. And here I'll listed some of the basic requirements for candidates. We do have heightened weight standards that you can go online and look into. And to become our USPHS officer in the regular Corps, you must commission the commissioning process and secure a position in the agency, where one of the agencies we went over earlier. Just know that the application process might take about 6 to 9 months for the whole process to be finished. Next slide. The Ready Reserve Corps. So this is a new component that was signed into law on March 27th through the CARES Act. It does allow for opportunities for a lot of different categories. I wanted to say all different categories to be able to join, similar to what our sister services do. The Ready Reserve Corps will provide trained and ready personnel to fill critical public health needs. It will help with capacity to respond to regional, national, and global health emergencies and improve access to health services while we are preserving the clinical care positions by having a surge capacity of health professionals. So that is also considered an option, especially for those that really want to help out but cannot commit to a full-time active duty position with the PHS. Next slide. To join our noble effort, we're recruiting right now service-driven clinicians, public health professionals, and all of the categories listed. And of course, do visit our website if you have any questions or you want to explore this a little bit more. This kind of just gives you a little overview of some of the benefits. Next slide. Some of the basic qualifications are listed here on the slide as well, and you can visit the website for those. And from now on, I'll hand it over to Lieutenant Wilson.
Okay, thank you, Lieutenant Gazarian. So what do pharmacists do in the United States Public Health Service? We definitely provide service to the underserved populations, and these populations are usually found at the Indian Health Service, the Bureau of Prisons, and the Department of Homeland Security, which I'll discuss in a little more detail as we proceed with the presentation. These areas can sometimes be remote and sometimes not remote, just depending on which facility you're in. But you can provide both clinical services, and then they also have many leadership opportunities at these agencies. I'll work with the Food and Drug Administration, where they play a key role in the new and generic, and also pharmacists will help with drug supply chain through different initiatives with the FDA. I'll discuss in a little more detail about the FDA agency and how pharmacists can be a part of it. But another thing that pharmacists does with the United States Public Health Service is respond to national emergencies, crisis response, and urgent health needs through deployments. And we'll also discuss that a little later on in the presentation. Okay, so to start off, the Indian Health Service. This is our largest agency, which employs the most amount of pharmacists. Currently, there's over 700 pharmacists in over 230 locations throughout the United States. Care here is provided to the American Indians and Alaska Natives. And there's 12 different service areas in 35 different states throughout the United States. So here again, you have several different clinical positions that you could work as a pharmacist with the Indian Health Service. You can have a pharmacist ran clinic through a collaborative agreement in the different disease states, as you see, and as we've already mentioned a little bit, in anticoagulation, hypertension, they have primary care, pharmacist ran clinics, pain management, asthma and COPD, oncology, diabetes. Really, whatever you're interested in and have a specialty in, they're willing to hear a pharmacist out to see what the impacts could be for having a pharmacist ran clinic at these IHS facilities. And then also non-clinical positions. You could get into pharmacy management or informatics, as I had the opportunity to get into when I was with IHS, and also work with quality assurance, quality improvement as well. Okay, the next agency that a pharmacist can work at is the Bureau of Prisons. This has a little under 200 pharmacists throughout the United States. And they have, of course, clinical positions. If you're interested in having a pharmacist ran HIV, hepatitis C, or mental health clinic, this would be the agency that you would want to go to, where you would have the most opportunity to have a pharmacist ran clinic in those areas. But the BOP also does pharmacist-ran clinics with hypertension and diabetes and anticoagulation as well. They offer APP rotations. They offer one of our senior co-step program, and the Bureau of Prison offers a PGY1 residency, and IHS offers a PGY1 and PGY2 residencies as well. So for more information on the senior co-step program or junior co-step program, you can visit our website at USPHS.gov. Okay, next is ICE, which is Immigration and Custom Enforcement Health Service Corps. They hire about, they have 20 different pharmacist billets here. And here you're providing care to the detainees at our immigration retention centers. Pharmacists practice through collaborative agreements here as well, again, more clinical, and can have pharmacist-ran clinics in anticoagulation, HIV, mental health, and the diabetes and women's health as well. Usually with ICE Health Service Corps and Bureau of Prisons, the pharmacist staffing is usually lower, usually 1 or 2 pharmacists at each facility with pharmacy technician support. And at IHS, you usually have larger groups of pharmacists, anywhere from 3 to 50 pharmacists can be working at an IHS facility. So if you're looking to have other pharmacists to bounce questions off of, IHS usually has more than these other 2 agencies. Another agency that we work as USPHS officers is the U.S. Coast Guard. Again, these are usually a 1 pharmacist ambulatory care setting where you provide care to patients throughout the Coast Guard bases in the United States. So you're providing care to active duty members, reservists, retirees, and then their other eligible dependents. And again, this is another clinical opportunity that you could have running pharmacist-ran clinics at the U.S. Coast Guard as well. And here, this is just, I'll let you read this briefly. This is just a testimonial from an officer who worked at the U.S. Coast Guard. And it's just basically talking about the expanded scope of practice that a pharmacist has, not only with the U.S. Coast Guard, but several other agencies throughout the USPHS. Okay, and then coming back to our Food and Drug Administration, here, this is mostly regulatory work. And of course, the officers, pharmacist officers who are working here are responsible for protecting the public health by ensuring safety and efficacy of all human and veterinarian drugs. So again, this is mostly regulatory work, either with drugs or with food and cosmetics. And pharmacists can actually work in either of these divisions. It doesn't necessarily have to be in the drug division. So with the USPHS, you have opportunity to move into all different divisions throughout the FDA. And if you're interested in traveling as an officer, there's a lot of opportunities through the FDA for international travel when you're performing different checks and when you're performing different checks on what you're doing as a part of your job duties. So here are just some of the different positions. Just some of the things that you can public health service pharmacists. We also work at the Center for Disease Control and Prevention, which is the CDC. There's a little over 30 pharmacists working across this agency and around the world. As you can see, over to the right side is just a pie chart and breakdown of the different areas that pharmacists are working in at the CDC. And there's also several different kinds of work settings that are available to pharmacists in this agency as well. Washington, D.C. area. And pharmacists can also serve in several other institutes throughout the NIH. Again, our NIH, they have pharmacists working in the inpatient and outpatient section of the clinical hospital. And then they also have clinical pharmacy specialists who provide service studies to study participants throughout their different institutes that they work in. And they also offer a PGY2 residency in oncology and have a 2-year pharmacokinetics fellowship that's available. And then our Centers for Medicare and Medicaid Services also have a lot of opportunities for pharmacists. Here, they provide operational oversight over our Medicare Parts A, B, C, and D, and our Medicaid coverages. And again, this is CMS, so they are supporting policy and operation for all of our Medicare and Medicaid recipients and beneficiaries. Okay, and then this is the Health Resources and Services Administrator. So here, pharmacists would oversee grants that are awarded to community health centers and other organizations to improve health and achieve health equity through access to quality services, a skilled health workforce, and innovative programs. So they have different opportunities throughout the United States. A lot of them are stationed in the Washington, D.C. area, and then they travel around the U.S. to do their, to oversee the grant programs that they are currently maintaining and managing. And then other opportunities for pharmacists is with our Office of the Secretary, which under that office falls the Office of the Surgeon General and the Office of the Assistant Secretary of Health and Commission Corps headquarters. And this is where both I and Lieutenant Gazarian are currently working as pharmacists. There's numerous opportunities that are multidisciplinary. They also have the Office of the Assistant Secretary of Preparedness and Response that falls under this office as well. So there's several non-traditional roles of pharmacists that a pharmacist could have in this office here. Okay, so I just went over several of the agencies that a pharmacist can work in as a USPHS officer. For more agencies that are available, you can visit our website again at USPHS.gov. And now I just wanted to transition over and talk a little bit about the readiness and deployment component of being a United States Public Health Service officer. And again, we do provide humanitarian assistance and disaster relief and emergency response to different issues that happen throughout the United States and the world. So again, what roles do pharmacy officers play in these responses? You can have a more traditional role as a pharmacist during these deployment responses, dispensing and counseling patients, giving drug information, providing immunizations. But you can also have other non-traditional roles in leadership, administrative roles. Here, just moving on to the next slide, we're showing our COVID-19 response as pharmacists. We've had over 4,500 officers deploy since March with over 200,000 deployment days. So pharmacists have played a large role in our COVID-19 response of these over 4,500 officers that have deployed. And pharmacists are serving at the forefront in, again, in screening roles, quarantine roles, case management, leadership and operations. We've had the opportunity to help set up testing centers and also our federal medical stations, which we have 42 of throughout the United States. So these are just a few pictures of our deployment responses from 2017, and these are when we had the 3 hurricanes hit one after another. Over to the right side is a picture of the federal medical stations that we were involved in setting up for our COVID-19 response, but this is where the care is provided. Over to the left side is the sleeping quarters for the officers, as well as the people who were displaced from the disaster. And then down to the bottom right is a picture of the U.S. Navy ship where USPHS officers collaborated with Navy and other uniformed service officers to provide care and humanitarian assistance on this U.S. Navy ship. And then here's just 3 pictures of the 3 hurricanes that hit in 2017, one after another. It caused several billions of dollars worth of damage, and also caused over 1,000 U.S. casualties. So it was very devastating to these areas where the hurricanes hit, and pharmacists played a large role again in these deployment responses. For these responses, there was a little over 2,000 PHS officers that were deployed. So a little less than half the amount of officers that have been deployed for the COVID-19 response. But of those 2,000 officers that were deployed, we had over 300 pharmacists deploy in multiple roles to assist with these natural disasters that occurred. Okay, again, so I just wanted to say thank you very much, and that will conclude the presentation. And now we will open it up for questions.
Thank you so much. And I just want to start off by looking at the Q&A section. The first question we have is, would I have to relocate to become a USPHS officer? I would like to say yes and no. If you are looking for an opportunity, depending on what agency you want to apply to, if you're looking in to get more clinical work, it would be within the IHS system. And if you're willing to get stationed in somewhere like North Dakota, where I was, I did have to relocate. However, it is not mandatory or required. So if you can find a position close to where you are right now, and there's a lot in Miami, Florida, there's FDA and there's ICE, just to mention a few, you would still be able to work from your current location. So yes and no. And I'll throw this one at Lieutenant Wilson. Are there part-time opportunities available with USPHS?
Yes, and then just one thing I wanted to mention about that last question was, I'm originally from South Florida, and I took a job with IHS when I first got into the Commission Corps out in Northeast Arizona. And after being there for 2.5 years, I then transferred over to the Washington, D.C. area. But at that same time, I was offered 4 other positions, and one of them was back in the Miami, Florida area. So I could have had the opportunity to go back home if I wanted to, but I just thought the opportunities were better for me in the Washington, D.C. area. So I selected another job. And then for part-time opportunities in the USPHS, yes, Lieutenant Kazarian covered that a little bit, but we're starting up a Ready Reserve Corps, which is a part-time opportunity. If you aren't able to do it full-time, there is this opportunity. We're currently accepting applications. Our application period just opened up at USPHS.gov. And basically what you would be doing is you'd be doing one of 2 things. You would be backfilling our high priority areas at like the Indian Health Service or Bureau of Prisons when officers from those locations went on a deployment, and you would be covering the amount of time that they would be on the deployment, which is usually between 2 to 4 weeks. And then another thing would be is that officers would be deployed, to areas that were in need of public health assistance. So Ready Reserve officers will also be deploying as well. And they're currently still working out the policy and procedure on this, but they are also planning on having, some kind of trainings once a month, like they would in other uniformed services for the Ready Reserve Corps. Okay, so then going on to the next question, how has COVID impacted your work, research, collaborations with the CDC? And Lieutenant Kazarian, did you want to answer that?
Yes, absolutely. And that's a great question. I do want to mention that, during this time, everything has changed so much that resiliency really has been at the forefront for all of the federal agencies. We obviously, a lot of us have been pulled for the COVID response. We've been reassigned to that, but at the same time, we're still continuing forward. And in times like these, we've seen within our work with either of the federal agencies that same thing that you might have seen at different clinics as well. Well, telehealth is taking a playing a bigger role in this, and we've had to overnight come up with a strategic plan. So we're still continuing full force ahead, but at the same time, a lot of us have been reassigned to the COVID response. As you heard Lieutenant Wilson mention earlier, I want to say close to 4,000 of Commissioned Corps officers have been deployed for the COVID mission. So there has been impact, but the ones that are staying back are taking on additional responsibilities, and also making sure that we're resilient throughout this because the fight is not over yet. Thank you. Well, I can.
Thank you. Yeah, can you, the next question is, are pharmacists prescribing in any of the PHS agencies at this time? Would you like to answer that one, Lieutenant Kazarian?
Absolutely. When I was stationed in North Dakota, and a lot of other federal agencies, when you have your rotations at the VA, you'll see this as well, that under collaborative practice agreement, you are able to prescribe medications for which you have the collaborative practice agreement. So just to give you an example, at my duty station, we were able to prescribe HIV PrEP and PEP medications, HIV treatment medications, hepatitis C medications, um, anticoagulation medications. The list goes on and on. So any chronic disease management state that you can think of, we were able to prescribe that under the agreements similar to what the VA already does. And I can throw this one at you, Lieutenant Wilson. I like that we're playing, we're playing this game. How often and what capacity does the USPHS Commissioned Corps work with the other uniformed services? I can start off by mentioning some of our deployments that we have done in
Yeah,
conjunction. Mhm. Go ahead, Lieutenant Wilson.
yes, absolutely. So as I mentioned, on the U.S. Navy hospital ships, we will go on deployments with them for humanitarian missions and be working with all the other uniformed services on the Navy ships, even with other deployments, especially our COVID-19 response deployments that we've been having since March. There's been a lot of collaboration between all the uniformed services there. In the Washington, D.C. area, we also have officers who work with the Department of Defense and National Guard, and who are also working at the Pentagon. So they are in their everyday work activity, they are working with other uniformed services. But and then when you're working like at your agencies, like if you were to be working at an Indian Health Service or a Bureau of Prison, at those times you're most likely not going to be working with other uniformed services. And Lieutenant Kazarian, if there's anything else you wanted to add to that, you can go ahead.
Yes, thank you. The only thing I'd like to add is I was also part of a rapid deployment force team, which essentially means we're the tip of the spear, the first boots in the ground if there's a national emergency that or a hurricane response. During those times, when it's quiet, we do get to train and get opportunities to train with our fellow services. So that's another place where we go into trainings with them, with all the sister services as well. Well, I can take a jab at the next one, and I'm sure I'll pass it on to Lieutenant Wilson after I answer, because I would like to hear what he has to say as well. What's been your most memorable experience at NSU Alumni at as an NSU Alumni at USPHS? For me, I remember very distinctly that we had the opportunity for Lieutenant Commander, then now Commander Dorcas Taylor from the FDA to come and present to us about the United States Public Health Service, quite like what we're doing today. And that opened up the door for me to look into all the opportunities that exist outside of your regular pharmacy world. And I'll be forever thankful. Lieutenant Wilson?
Yes, thank you. So I didn't have the opportunity to hear about the USPHS while I was in school, but I feel like that the NSU Pharmacy program provided a very solid foundation for me as I made my transition into the USPHS. I started off working in community pharmacy and then transitioned out to a more clinical pharmacist role with the Indian Health Service in Northeast Arizona. And I feel that the pharmacy school provided me with a very strong foundation to be able to succeed in all the different pharmacist ran clinics that I participated in and all the work that I did there as well with inpatient and emergency department services. And I also remember one of my most favorite events that they had while I was a student at NSU was a Lion Country Safari Family Day. And I just remember that being something outside of academics that I really enjoyed, and bringing my family to the Disney on Ice. So I was glad to participate in those outside activities as well. And then the next question is, what are the basic qualifications and weight standards of the USPHS? Does an annual physical fitness test need to be completed?
Yes, I can start off with that. We do have basic qualifications and weight standards. They are listed on our website, which you may visit, and it depends on your age, and it has like a whole table, quite similar to what our sister services do. And we do have an annual physical fitness test. And I have to add that that always keeps me in check with Thanksgiving and Christmas coming along. I know there's going to be a lot of cooking, so I usually do my APFT right around February and March, because I know all the weight that I might have put on during that during the holidays, I can run it off pretty much. But it really does help you stay disciplined and take care of yourself physically. Lieutenant Wilson, would you like to add something to this?
Yes, I was just going to say, so yeah, the annual physical fitness test just needs to be completed once a year. We follow the Navy standards. Those standards can be found online if you Google USPHS annual physical fitness test requirements, and you can see the requirements for that. And then going on to the next question, what is the application process for the Senior Co-Step program? Are there interviews in addition to the online application? So I could go ahead and answer that one. So it's the application process is an expedited application process for fourth year students. Senior Co-Step would be for fourth year students, but they would apply in their third year. And it usually takes, they would usually be starting the Senior Co-Step program when they're starting their rotation, their fourth year, their first rotation of their last year. And they'll usually complete their rotation in a 9-month period. They would be obligated to, in return for paying for the USPHS paying for their schooling, they would be required to serve double the amount of time in the United States Public Health Service that we paid for their schooling. So if it took them 9 months to complete their last year of school, they would be obligated to an 18-month term in the United States Public Health Service. But what that means is as they graduate, they don't have to secure a position for themselves. They would already have a position in place with the United States Public Health Service as a pharmacist upon graduation. And they would have their last year of school paid for as well. So there is also an interview process along with the USPHS application that needs to be completed.
Yes, and
our senior co-step applicants also have to follow all of the same weight and height standards as our general duty officers. So they would kind of be going through that whole same process as well.
Yes, I'd also like to add that when I was looking in, they weren't hiring at the time for any of the junior or senior co-step or even for general active duty. And this time we are, so definitely look into it, because this is an opportunity that's come up. It's rare. During my time, I had to wait for at least 2 years to be even able to apply. So we are very excited they were able to recruit more pharmacists. The next question is, how can I get involved as a U.S. Public Health Service officer?
Okay, yes. To get involved as a USPHS officer, you could visit our website at usphs.gov. They have a preliminary screening questionnaire on our website just to make sure that you meet all the preliminary requirements of being an officer. And then from there, you could go ahead and get your application moving forward at that time. And with the PHS2, you just have to remember that you complete a USPHS application simultaneously with your agency application. So there's two different applications that are moving through the process at once, one for your pharmacist position and then one with the USPHS. Once you complete the PHS application and get called to active duty, the only application you would need to fill out moving forward when you decide to move duty stations would be your agency application to wherever you're applying for a job. And then one last question, is there still time to apply for the junior and senior co-steps program this summer? Well, I could go ahead and answer that. Actually, no, that the deadline or the open application period is passed. Each year, the application period has been open from June to September 30th. So as of September 30th of this year, we stopped accepting applications. And then June 1st of 2021, they'll be accepting applications again for the senior and junior co-step programs.
And those are all the questions I had. Please, thank you so much for attending today's webinar. I do have the contact information for myself and Lieutenant Wilson in the chat as well, and I'll turn it over to our organizers.
Yes, thank you very much for tuning in today. Have a good day.